Delta State Police Command
You're
has
welcome.
arrested one Mrs Odiase Ibhade Stella, an auxiliary nurse, following the death of 21-year-old Elizabeth Oyibode after a botched treatment in her chemist shop. Police operatives from Ekpan Division sealed off the facility located near New Era School off Jakpa Road, Warri. Oyibode reportedly died 3 days ago at Warri Central Hospital after suffering severe complications from medications administered by the unregistered nurse, including brain and body paralysis that rendered her unresponsive. The National Coordinator of Initiative for Social Rights Concerns and Advancements, Comrade Derek Orisemasa Agberen, said the case must serve as a deterrent to others in the illegal medical trade. He explained that Stella first misdiagnosed Oyibode's fiancé, Jonathan Okuma, with a bacterial infection, then insisted on including Elizabeth in the same treatment plan because they cohabited and had a child together. Despite warnings, the auxiliary nurse allegedly diverted money meant for the diagnostic test to administer injections and intravenous drips in her chemist. Jonathan returned from work to find his fiancée unconscious and receiving unprescribed treatment. Agberen noted that Elizabeth's condition worsened, eventually leading to her death from complications. The group praised CSP Shaba Aliyu of Ekpan Division for his swift police intervention. The police confirmed the arrest and promised further investigation into the circumstances surrounding the young woman's death. You know, in Nigeria, Ololade, we have become the people that people don't bother to do tests. You have a small headache, you run to a little, pharmacy shop or a chemist, and you say, I have headache. Sometimes they mix different prescriptions. Other times, without having due tests done, they say, okay, it's typhoid, you're showing symptoms of typhoid, and people go on to take this, medicines, and without knowing the lasting effect it has on their bodies. What are your thoughts on this report?
Okay, this is quite a sad one.
Right.
It still boils down to the fact that you need to take your health seriously. And we are in a situation in this country where people would usually opt in for the easiest means. I mean, based on whatever they can afford. So, which is why basically they rely on, this kind of people for
treatment,
for their health issues,
right?
Their health treatments, conditions, and what have you. The problem that I have here right now is the fact that why do these people still operate? Because, I mean, you're not qualified in the first place. You don't even have a license in the first place. Why are you? And I don't know. I'm just, because I'm on here right now, I'm trying to, choose my words carefully.
Right.
And I feel like if there are regulatory laws,
we are meant to have regulatory bodies. I'm sure that there is a board for pharmacists
that are actually authorized to do these things.
Right.
Then, I mean, there'll be a reduction in the loss of lives, the, what have you that we have right now in this time and age. So, I don't know, I just want to plead to, the right authorities, whoever are in charge, to take things like this up. We need to evacuate. I think that's what I'll use. Evacuate on professionals in the health sector, especially because health is very important. I mean, look at, what just happened to this person right here. They had actually gone to the right, the right people to the hospital to do a normal checkup. Of course, definitely, they would have the right treatment, they will have what to do. But the problem is, and I understand, the problem is the means, which is why people opt in for.
When you say
when
you say the means, what does that mean? Is it that, do you think people opt out to use this service because they cannot afford to go to the hospital? Do you think the prices of the hospital, what they charge is too high? And then again, you remember that we have government parastatals as regards government hospitals, government health centers. Do you think that, there is an issue with those places, that is why people don't go? Do you think it's overcrowding? Why do you think people still patronize, roadside and self-prescription medications?
Not sure I got you right there.
Can you hear me?
Yes, I can now. The network was fluctuating a
Oh,
bit, but I
pardon.
think I heard where you
Pardon me,
said,
please. I
I
was talking
mean,
about, you said, you understand because they have to do with the barest minimum. So I was saying, why do people, subscribe to the barest minimum? Do you think it's because the prices, because of finance as regards, you go to the hospital, the price to pay is too much, especially when we're talking about, private parastatals as hospitals. Do you think it's because maybe the government institutions, government clinics are too crowded? But then again, if you say the general hospitals are crowded, we still have health centers. Why do you think people would rather visit this, unregistered and unknown, or we are even not sure if they're certified, but people would rather go to those areas to get treatment, self-prescribed, as opposed to going to see a doctor to get an actual prescription for what they should take for their health?
okay, first of all, I would say easy access. I mean, these people have a small kiosk in the front of our houses. Okay. So you're stepping out, you're stepping into their shop right directly. So it makes it easy for anybody who is feeling unwell, oh, I'm feeling this. What do you think you have for me to, get myself better? So also I would also say attitudes. Yeah, I would say attitudes of, those professionals as well. Because it can be a lot. I mean, you're going to the hospital, you have a long queue, right?
Right.
And you have people who are who is into consultation with the doctor, and you are here, you need instant treatment, you're feeling somehow. And it's crazy because people don't usually want to do this. Now, let me cite an example. I remember during my uni days, I'd rather go to a pharmacy in my area to get a malaria drug because myself, I feel like I know the symptoms already. So this is the malaria symptom. I'd rather just, go to the pharmacy near my area because I don't live on campus here. I live outside of campus.
Right.
But most of the time, I don't have access to pharmacy in my area. So I'd rather choose the pharmacy on school campus.
Now you choose the pharmacy on school campus because and self-prescribe, as opposed going to get, checks done because you think you understand your symptoms.
Not because I think I understand my symptoms, but because number one, I don't trust the system of, the health center. And secondly, it takes a lot of time. You're going to wait.
Right.
Trust me, you're going to wait. And I don't have that strength anymore. I really need to get myself together, get a drug, eat, and just sleep. So I'm really just opting for the school.
Now,
I need a malaria drug, or probably if you don't understand what you're feeling, you can explain it to them, and they just give you the right drugs to prescribe.
Now, if we go back to the report,
I understand
if we go back to the report, you see that is exactly what the man did. He went to the pharmacy and said, okay, I'm having ABCD symptom. And she said, you have an infection. An infection is not something that can be seen on the face except through a microscopic lens, for them to ascertain, okay, this is what has caused you this kind of pain or this sort of feeling that negates that, okay, this is why you're not feeling well, right? That nurse did not take that procedure to check why this man is feeling the way he was feeling. She quickly highlighted that, oh, he has an infection. Now, bringing Elizabeth, his fiancée, into it has now caused her death, right? I want to point out to something you referenced as regards the monolithic nature of the hospitals and the health centers, because when you go there, you get to spend a lot of time. Do you have, any thoughts or any ideas you think can be implemented just now to, help us move from this monolithic structure to something much more streamlined and, making it a more easier, nicer flow as opposed to the long queues that people get to, citizens and people get to suffer in Nigerian health sectors and, health centers and hospitals when they go there for checkup?
Okay. I really didn't know how to put
I mean, since you have experienced it, what structures do you think you can advocate for a change for?
A better way to do this is
right.
Should make. I'm sorry.
I was saying that you have actually experienced the monolithic nature and the tightness of getting to see a doctor from these health centers and hospitals. Now, from your purview, having seen the structure, what do you think needs to change for it to be more efficient? And, in order for us to boycott this self-medication and going to the health centers without having due diligence done before medication is administered?
Okay, first of all, I would say when we have enough hands on deck,
okay,
I think things would actually move more faster. Because some of these health centers where you get there, you're probably seeing just one doctor, not even a doctor. Probably you're just seeing 2 nurses. And this is quite alarming, which is why people would even want to opt in for the small kiosk in front of their house, because they feel like, okay, there's a nurse at the health center. This one too safe. It's not really, it's not something that you can manage. So which is why they would opt in for that. So if we have enough practitioners on ground, and then we have the right attitude to work as well, I think it would go a longer way for people to actually trust the professionals themselves, because even the attitude itself is what really scare people to even say, oh, I want to go.
Right.
You're not going to actually get answered on time, or probably not, going to see the doctor that day. So which is why I would say when we have enough trained personnel on ground, and when we have the drugs as well, sometimes even the drugs are not available. They'll tell you to go and buy it outside. So which is why people would even want to opt for the kiosk in front of their house as well.
Right. So we need a total overhaul.
Things, I think just a better way. Exactly. Yes. Yeah.
Well, thank you so much for your insight on that.